Welcome to Ren Behind the Practice. I'm Sophie Campisi. I'm a holistic business strategist and startup expert, and I spend a lot of my time in conversation with practitioners, coaches, and healers about the behind the scenes of their businesses. What I started noticing is that some of the most honest, important conversations about building a practice were happening quietly, one-on-one, behind the scenes, and often in isolation. Most practitioners are incredibly skilled at the work they do with their clients, but very few of us were ever taught or trained on how to build a successful startup business. And suddenly we've been left to figure it out on our own. This podcast exists to bring those conversations forward. The dreams, the uncertainty, the highs and lows, the recalibrations, the messy middle. My hope is that by normalizing these conversations, we can soften the stigma, feel less alone, and start closing the gaps together. Today's guest is Dr. Meaghan Howe. She's a practicing functional medicine podiatrist and epigenetic specialist and the founder of Code to Healing. Meaghan, it is so great to have you here. Thank you for showing up and having this conversation with me today.
Thank you so much, Sophie, for having me. I'm very excited to chat.
Before we look behind the scenes today, can you share with us a little bit more about the work that you do with your clients?
Definitely. I began as a fairly traditionally trained foot and ankle surgeon, and then due to gaps that I identified in my practice, I sought further education in the functional medicine realm and then applied that to podiatry, which morphed into my passion of looking at people's genetic profiles and identifying where their cells are breaking down, and then how we can redirect that into a personalized path to healing.
Was there something specific that had you interested in coming outside of the traditional Western model of medical care and seeking out some, and I usually use the phrase holistic. I think you use functional, but coming outside of the traditional Western model?
100%. And I think many other physicians can identify with bushwhacking a trail in the area of services where they required them first. So I was given a prognosis of early onset Alzheimer's disease, and there was no route in the Western realm for prevention. So it was the exact path and care that I needed that I have come to be able to provide for my patients.
Can you give an example how you are integrating more holistic or functional approaches into your practice? Like, how are you weaving them together?
Yes, definitely. So, for example, if someone comes in with chronic plantar fasciitis, right away you know there is a chronic inflammation issue at bay. So that really needs to be addressed before they're going to get better. And that is missed most of the time in a traditional Western setting. So that's where we can implement different lifestyle adjustments. And patients are usually aware, so they provide the history and the information. So you already know you can come up with a treatment plan to alleviate that. And then when we look at their genetic report on a cellular level, it will show us, okay, their body needs more support in the detoxification area, or maybe it's a hormonal issue, or a combination. So hacking the root of these recurrent problems. And many people are familiar with the amount of stress related and chronic inflammation related complaints that show up in the office. And they are recurrent because they're not being adequately addressed, in my opinion.
Totally. I mean, it's a classic addressing symptoms and not finding the root cause, which seems to be a theme for major breakdown in our current medical system. Is it common to see practicing physicians and doctors incorporating other things into their practice now when they're starting to notice gaps? Like, would you say I'm assuming it's becoming more common, but I don't know.
It's a slow roll. They're few and far between, but it is a combination of, I would say, doctors needing their own services and then beginning to provide them, and also patients getting a little bit fed up and advocating and asking, what else can I do? I know there's something, I just don't know what it is.
So interesting. I actually had a conversation with someone last week, and she was telling me about her own experience with something that's been going on. She's been going to doctors. Her gut and her intuition is saying it's like this or this. She's been going to doctor after doctor. They're saying, we don't see anything. We can't see anything. We don't know
Hmm.
what it is. It's still happening. And she was, I think I actually might have mentioned you. It has nothing to do with exactly what you do, but just say, I was actually just talking to someone that was about this. There are doctors out there. You might have to search, you might have to find them, but
Hmm.
there are some out there. But what you just said was really interesting, that because clients can use their voices and can advocate, that could be a way that we also see more doctors adding in, or branching out, or at least just asking questions, at least pausing, which,
Yes.
is probably going to be a big piece of the puzzle, is reminding people, like, say it. And they might say no, but at least if 10 or 15 or 20 people say, hey, what about this? Or I heard about this, it might start loosening things up.
Definitely. And there is kind of a joke in the surgery realm where if you go to enough surgeons, you will receive a surgical plan. So if you go to enough doctors, that will eventually align with how you're feeling about your body. And so that's one of my main roles, is promoting the sense that people already have about their health. But if a doctor that they saw isn't rehearsed or versed in where that could be coming from, it's a gray area until you can give them their power back a little bit.
When you look ahead to the next 6 to 12 months, what goals do you have for your work and for your practice?
Right now, I do mostly one-on-one work, and so I see that expanding into group settings where people have a common goal. And also in the frequency medicine realm, there are a lot of cool devices that can be used in group settings. I love planning events, so doing that on a larger scale. That's with patients or clients. And then within the physician area, a lot more collaboration. We are trained to compete and react. And so this is totally the collaboration stage.
Yeah, it's so true. I mean, because we all know that all of us in this pocket of the world who are practitioners, coaches, healers, who have explored holistic healing, we know that there is absolutely not a one size fits all. Like, it truly
Mhm.
is holistic. It's interconnected pieces that will always inform the greater whole. And even my own experience, like, I have, that about my background. I was an athlete all the way through college, so many injuries. I've had so many surgeries, 2 hip surgeries. I have a screw in my wrist. I have a plate and 6 screws in my shoulder. I have so many. I had a spinal fusion. Next stuff, later on in my years, even now, for instance, I'll go to a chiropractor. And I know a chiropractor is thinking more holistically, right? Let's do adjustments
Mhm.
and do, but
Whole body.
it's,
Mhm.
yeah, but I'm still like, yeah, but if you're doing my adjustment and not also talking to me about massage therapist or a PT, I'm still like, yeah, but that's just, I'm not changing anything. Nothing's going to
Mhm.
change. This is going to come back out, So even things like that, it's like one piece is only going to do so much without that collaboration. So I've even been like, gosh, if more chiropractor offices had a massage therapist that could do like a 10-minute, I'm like, I wish I could get like a 10-minute, micro focused thing right after, or have a PT right there, like more holistic ways of treating things. Because I know
Mhm.
that even though, for instance, chiropractic care, it's so valuable, I know it's limited. And I know some of these things, but I'm a busy mom. It's like, yeah,
Hmm.
I don't have the time. I wish more practitioners were collaborating because I
Yes.
don't have the time to piece together so many of these things. I wish at the doctor practitioner level that there was more collaboration. It would take huge weight off my shoulders as the client to
Hmm.
have to figure this out on my own. And it would make it so much easier if there was collaboration on that level.
Yes. Yeah. And there's a lot to be said for most medical care revolves around, as you're describing, disconnected services. And we're taught what we're taught in that realm and taking the guesswork out of it. So, for example, like when we look at a patient's genetic profile, there are certain markers or certain nutritional deficiencies that might be common for something. So I can kind of piggyback that and then work with the primary care and say, hey, has this been on your radar, and facilitate that collaboration. So just taking a little bit more time up front pays off. And then the patients are happy, they're feeling better. And that's the most rewarding work that there is.
When you talk about expanding to more group work on the actual business model side, does that take you outside of your current business model? So, like, is that stuff that would still be within the insurance model where people can join and pay, or is that kind of popping you out to have like a parallel running business model?
It definitely pops me out to a parallel model as more of an educator. And I see that, educating to a group of physicians, for example, not forcing anything upon anybody, but if they are open, these are ways to consider to integrate.
Yeah, because in doing that, most of the people that I talk to who end up doing something like that are therapists, so they're either coming out because they're craving to come out completely of the model, or they're doing kind of like what you're talking about.
Mhm.
They're still maintaining their practice where they're licensed and people can pay insurance and they're taking psychotherapy clients, but then they're popping out these kind of like second business models that are way more true entrepreneurship because there's
Mhm.
not the business model of the insurance, supported client pay type thing. And
Mhm.
that ends up being a whole new ball game for them. We're like, wow, like I didn't think about this. I didn't think about this. So it's very interesting for those of you who have that going on. I'm seeing it more and more. And based on what you're saying and the conversations that I have with people, I think we're just going to see it more and more where people
Mhm.
are seeking some more freedom and seeking doing something that's outside of just like being stuck in that old model. The flip of that is it turns into a kind of pure entrepreneurship in those
Mhm.
in those endeavors.
Yes, yeah. And if you think about the reach of that, one on one versus 1 to 30 physicians, and then each of them have what, 20,000 patients a year, or, in those big groups. And so that can spread like wildfire for people that are open to it.
What do you feel like you need to do specifically? Let's think about the group work that you talked about, some of these, additional services that you're interested in. What do you think you need to do to get there? Do you feel like you're guessing, or do you feel like you have a pretty good idea of what it's going to take to start building up that
Hmm.
that side of your business?
From day one, gaps were identified. And so it's always been about building that bridge. And so it's not one or the other, but giving people the education that these are the treatment options you can choose from. You can still choose a steroid injection, but let's at least consider what our other options are. And that might be more fitting for your body or your situation. And so again, it's custom, and the power is back within the patient to choose instead of me saying, you need to do this for this problem. It just doesn't cut it anymore, and it doesn't feel authentic for on the other end, the receiving end either.
What would you say if you have a client in your office, they're coming because they have a classic foot pain or, whatever brings them there, they themselves haven't ventured out into the holistic world or the functional world. They come to you to, again, solve this thing. You say some of those options. Whereas before, if someone was like, you need a steroid shot, they would have just taken the steroid shot because they didn't know anything better.
Yep.
Are they interested or leaning into the functional holistic approaches, even if that's something that they haven't been aware of on their own? Does that make sense?
Completely. So when I first started talking about natural modalities, there was about 40% receptivity. Now I would say it's about 80%. It has to do with the way that I'm speaking about it and also what I can share with them from what I've used personally and in the progress and response that I've seen. And so, for example, with a steroid injection, for capsulitis, like inflammation of a joint capsule. We can do a steroid, but oftentimes people will require repeat steroid injections. And if I use one of the plant-based injections, oftentimes it's one, maybe two injections. And so I just explain that they're both working to achieve pain relief, where the steroid decreases the immune response, and that's how it achieves pain relief. And the plant medicine gathers healing factors to the area. And so there's more additive relief over time. And then they can think and choose. So I always say, if you're open to trying the plant one and it doesn't work, we could always do the steroid. It doesn't count that out just because you're trying something else. And it's amazing. I've had people drive like 2.5 hours because it works so well and they're investing in that long-term relief too. So proof is in the pudding, I always say.
I mean, that's amazing. That's doubling. And how long about have you been incorporating more natural, holistic alternatives into your practice? Because to go from 40% to 80%, that's a huge, significant jump.
Yep, about 7 years. And as a mom, I work part-time. So I've always worked part-time since I started practicing. I'm going into my 10th year practicing. And so you have people, most of the new patients that I have are word of mouth and referral based on someone that had a positive experience.
Wow, that's amazing. That really, really is amazing. What else do you think it's going to take on the action side of wearing more of your entrepreneurial hat when it comes to trying some of these other types of avenues for getting your work out there, whether it's group work or whether it's trying to train other physicians or some of the other things that you mentioned? What do you think it's going to take on that
Yeah,
side?
I think learning to share the systems that are occurring has been a challenge for me, but I feel way more comfortable with it now because when you're treating a patient, you're not explaining to someone what you're doing. And so when you come to collaborate, it's important for other providers to know, what are you doing that's resulting in this outcome? Sharing that, being able to provide written information about it, that's all the entrepreneurial aspect. Even I made my own website. And so you wear, as you said, many hats and you learn and you get better as you go, for sure.
What has felt hardest about this? So I guess, maybe even going back 7 years ago when you started to try a new thing, you started incorporating something that probably wasn't very common. Maybe you hadn't seen someone do it successfully. Maybe you were just trying to pave your own way. Maybe you did see some. What has felt hardest about that, or what did feel hardest about that?
By far, the most resistance comes from what people's subconscious motivation is to get better. And for the most part, it's the fear of disease, and it's not the peace of feeling better. So I always, probably by The second or third time that I'm working with someone, start to break that down, and people will share with you openly, whether they're aware or not of the words that they're choosing, about what they're afraid about. Oh, my family member had breast cancer, or oh, my aunt or uncle has Alzheimer's disease, and that's why I can't get it. And so, really dismantling and flipping the script of, again, the power of health by reestablishing balance in the body is the grunt work, but the most transformative.
Totally. I mean, I think we're just at the beginning of this wave of these types of things, like you just said, getting more mainstream. And someone like you is a great example of how that's happening, where you have people that are trained in the Western model, the model that's been trusted for so many years, bringing in this new layer. It's like a bridge. I mean, you already
Mhm.
used that word. People like you truly are like a bridge. And we think of these other spaces like, healing spaces and telepathy and quantum and all of these things. It's usually the doctors that are able to really be a bridge of trust. And it's going to be so vital. And something like you said, it is. Those of us who have studied this stuff, we know how important that fear is such a powerful emotion. Like, it's so powerful, and it absolutely can be the root of, and part of my expertise and training is in a type of linguistics. It has basically everything to do with what you just said. The power of shifting the
Mhm.
speaking is so important, because people don't realize that language lives in the body. It is a biological phenomenon. And there is science that backs this up. This is just one of the things that
Yes.
people aren't talking about, but language lives in the body. It is a biological phenomenon. Emotions get stuck and get trapped. You can move emotions more effectively than anything by shifting the language around them. Again, one of these things that isn't really talked about, but people like you playing such a vital role in the bridging. So I really just want to acknowledge you for that, because it is so hard. Oh my gosh, I'm sure. But you're doing the real work.
Thank you. Yeah. And it is my passion. I love it. And people don't realize they come into the office with the wisdom of their body presenting as symptoms. And so we say, okay, what's your body saying today? And then I help interpret that and break it down. I say, okay, that makes sense for me. And so it really is about giving that language to a physical symptom to release it. That's why it's speaking up. And so I love to say that to patients. This is how your body's talking to us. What is your body saying?
I mean, that's a great example of what is real, what is true, and the power of that. You're putting language to shift their speaking, shift their thought pattern, shift how they are thinking about what's going on.
Hmm.
And it might seem simple, even like you said, well, I even say it like that. No, that is how we can, it's a type of, shamanism guide. You can use your words and your language to help guide people to these new spaces. And even you saying that, what's your body saying today? So huge, because that is
So
going to
powerful.
change people's whole relationship, or has
Mhm.
the potential to change someone's whole relationship to listening to their body, seeing things as a
Yes.
symptom, seeing things as a sign.
A lot of people will come in and say, oh, I can't do this and I can't do this because of this foot. And it's just, giving me such a hard time. And so then we flip that, say, like, how do we honor what your foot is saying, symptom wise, and then reestablish grace there? And they feel better very quickly.
I'm laughing thinking of this. Like, my mother-in-law a couple weeks ago was telling me she had a friend who was diagnosed with cancer, and stage 4, something very progressive, and was like, no signs, no symptoms, and of course in my head I'm giggling, I'm laughing, yeah, right.
Hmm.
Yeah, right. But then later on that conversation, So yeah, his back is always hurting and stuff. I'm like, okay. So there was probably so many signs and symptoms.
Mm-hmm.
I did that, like, he was overlooking because he was getting older. So I'm sure there's like some gray area there, like what's natural, whatever, what's not.
Sure.
But also, how many times was he saying, yeah, my back is hurting? Or like this, like we aren't listening and picking this up. Like there
Mm-hmm.
were probably so many signs,
Mm-hmm.
all that pain that he was saying, or, whatever was going on, or the blood or the coughing, or, all these different things that our body's talking to us all of the time. It's going to
Mm-hmm.
tell us we have to be. This is where kind of also just the whole stillness and state of, I think, of course, social media and phones have just exacerbated our disconnection from listening to little things, which
Mm-hmm.
I'm sure in your work, like that's just the most important thing. To be able to have enough stillness to listen is,
Yes.
it takes cultivating that. And we're so disconnected right now in phones and like filling every crack of space with a podcast or something. I'm even working on this with myself all the time. I have little kids, so it's like just getting used to that and have to push myself to like, okay, you feel like you're behind, but like, don't put on a podcast right now. Like,
Mm-hmm.
don't fill this crack. Like, what if you just like kept this one and let your mind wander, even though it feels a little uncomfortable, or, these things like were one of the things I'm sure that is hugely impacted by this constant state of stimulation is listening to your body.
And there are a lot of cultural beliefs about health that become superimposed, for example, in pre-cancer diagnosis, where we're telling ourselves to power through something that is not our truth. And so stopping and asking, does this belief or advice to myself serve me in this situation? And how many times have I told myself to power through something?
Totally. I was actually just watching the Rafa documentary, the docuseries that just came out on Netflix. And I didn't know this because I'm not much of a tennis watcher, but he had like a chronic foot disease,
Mm.
throughout his whole career that started from just overtraining before
Hmm.
his growth plates were closed. And so he had all these
Mm.
like chronic foot problems. And the whole thing is like he got this disease because he was who he was, and just like overtraining. That's such a theme and a pattern throughout the whole thing. I thought
Hmm.
that was so interesting. But yeah, it's like power through, push through the pain. Like
Hmm.
just keep going.
Yep.
Is there anything else that has felt especially unclear or uncertain for you as you've started to incorporate new things into your work, into your practice?
If anything, I've gained clarity over time, and you really, come into alignment with where that path is going. And that requires acceptance of what doesn't resonate. So, for example, it's really hard for me to stop operating at a hospital because I was so trained to do that. And I love anatomy, I love actually performing surgery. But just because I can do that well doesn't mean that is part of the next path. So I've gained a lot of clarity over time.
Last question I'm going to ask you before we wrap up today. If you could wave a magic wand and have one thing solved or fixed for you in your building process, what would that be?
I would say it would be waving a wand of truth. So I think when patients come to see me, they feel a sense of reprieve because I'm truthful and authentic. And I say, this for me, this is what I would do. And so I believe that would clear a lot of resistance for people to be able to choose what kind of health that they want, and again, make connections faster when the truth is very clear and apparent.
Meaghan, thank you so much for joining me today to have this conversation. And for those of you who are listening, if any part of this resonated, you're in the right place, please reach out. I want to hear from you. And if you want to reach Meaghan directly, the link to the Code to Healing website is in the show notes. Thank you again, Meaghan, and to everyone else. Thank you for listening. And we'll see you for the next episode of Ren Behind the Practice.